Hello, World Wide Web. This is Second Lieutenant Anderson and Second Lieutenant Scott. We are going to be talking about prophylactic taping versus bracing for prevention of lateral ankle sprains. First, to give you a brief outline, what we'll be discussing today is introducing the topic with some definitions and just overall understanding, conceptual stuff, looking at the search strategy that we used to identify the research that we used, looking at level 1 evidence, level 3 evidence, level 5 evidence. Then we'll be discussing a couple clinical practice guidelines and ending with the recommendations and conclusions that we have made for you here today.
With a prophylactic intervention, we're specifically referring to preventative care. Types of taping that are typically used are a rigid strap or sports tape, which does offer the greatest stability, elastic tape, and kinesiology tape, which is a form of elastic tape, but it acts dynamically to support movement. Ankle braces are typically either a lace-up or a semi-rigid brace, although one of the studies we will talk about looked at soft braces. With lateral ankle sprains, we are referring to injury of either the ATFL, CFL, or PTFL. ATFL is the most commonly injured ligament, whereas the PTFL is rarely injured. To reiterate what we learned in class, these usually occur when the ankle is inverted while being plantar flexed. It should be noted that the most significant risk factor for ankle sprains is a prior history of a lateral ankle sprain. So you can see that we looked through 3 databases, PubMed, PT Now Clinical Practice Guidelines, and Cochrane. You can see our search strategies on the screen. While searching these 3 databases, we did find level 1 and 3 evidence available. However, one difficulty that we faced was not being able to find level 2 evidence, specifically comparing prophylactic bracing and taping within the last 7 years.
And this leads us into talking about the level 1 evidence that we had today. This is a systematic review on the treatment of acute ankle sprain, brace versus other functional treatment types. So this systematic review pulled from a vast array of information and research and found 8 articles that met their criteria, as you can see outlined below. Using the best evidence synthesis of the 8 articles, due to the varied outcome measures that they had, the authors concluded that while some studies reported positive outcomes after treatment with an ankle brace compared with other functional methods, the results only demonstrated a better treatment result in terms of functional outcome. The reviewers concluded that because the results of 2 of the 4 high-quality studies were significant, the evidence can be classified as strong. Now, 2 braces had a major influence on the talar tilt, and only these 2, which were the Aircast standard brace and the step-in safety brace, were considered to be effective for immediate post-trauma treatment and the prevention of ankle sprains. Despite this conclusion, several studies included in this review reported the opposite or were unable to uphold this conclusion. According to the Dutch College of General Practitioners guideline for the treatment of ankle sprains should be treated by taping for 6 weeks. Nevertheless, this systematic review found evidence for a better functional outcome when using an ankle brace, and that treatments with ankle braces did not show any unfavorable effects. In addition, findings of other studies suggest that this method is more cost-effective, and so using an ankle brace for treatment of acute ankle sprains really should be considered, although the guidelines for the Dutch College of General Practitioners was suggesting otherwise.
The next study we looked at is effects of soft bracing or taping on a lateral ankle sprain, a non-randomized control evaluating recurrence rates and residual symptoms at 1 year. We considered this to be level 3 evidence. This study examined 150 participants with an acute lateral ankle ligamentous sprain. Of these participants, only 81 completed the trial. This limitation was mostly due to skin irritation. Outcome measures were the recurrence of ankle sprains or the presence of residual symptoms, with measurements taken at both 4 and 52 weeks. Participants were either allocated to the soft bracing or taping group based on their order of participant recruitment, which was another limitation listed for this study. The soft brace was worn for 4 weeks with the exception of sleeping and bathing, whereas the athletic tape was applied 2 times, each for a period of 2 weeks, unless it was compromised and the patient needed to revisit the clinic in order to be retaped. Practitioners were allowed to choose their method of taping, which was considered another limitation of this study. Some participants also sought out medication or additional physical therapy, which was not controlled for. However, there were no significant differences found for the use of medication or additional therapy. At 1 year, there were no significant differences in swelling, functional outcome, active stability, or pain. However, the brace group did show poorer scores on the anterior drawer test. The last limitation of the study that I'll mention is the recurrence of ankle sprains were determined by the participant and not by a medical professional. This study concluded that the re-injury rate is similar with both soft bracing and taping, and that prior research which supports a lace-up or semi-rigid brace should be followed. The next study is role of external prophylactic support in restricting ankle motion after exercise, also level 3 evidence. This study looked at 24 participants who had both ankles measured to examine the effect of bracing and taping on individuals with and without previous injury before and after exercise. Participants were assessed with the Cumberland Ankle Instability Tool and divided into one of 3 categories. They were divided as either a healthy control, a potential coper who had experienced an injury but had no structural instability, or as functionally unstable. An ankle arthrometer was used to measure accessory ankle motion. They chose accessory motion because it can indicate joint laxity, which is believed to be a risk factor for re-injury. These accessory motions were anterior translation, inversion, and eversion. This was a within subjects experiment. Once a week for 3 weeks, participants came into the clinic and their measurements were taken before the application of a brace or tape or no support. After the application of the support before exercise, they were then taken through a workout, and measurements were taken again while still having the support post-exercise, and then again after the removal of that external support. Each participant went through all 3 conditions. Overall, there was greater stability with all 3 motions when a brace or tape was applied. However, tape showed greater stability in inversion and eversion, and stability decreased after exercise even when the external support was still in place, indicating that fatigue plays a role. This study concluded that it is important to consider that bracing provides more mechanical restriction compared to no brace and is a more cost and time efficient option than taping. A level 5 evidence piece that we looked at is management of acute lateral ankle ligament injury in the athlete. This was a narrative review which examined studies from PubMed, Ovid, and Embase that examined the treatment of acute lateral ankle injuries in professional athletes. The severity of the ankle sprains ranged from overstretching to complete rupture of the ligament. This narrative review concluded that bracing is more stable than taping and that lace-up braces specifically may also reduce swelling during the acute phase of the soft tissue healing process. Semi-rigid and lace-up braces show a significant reduction in recurrent ankle sprains. However, there is controversy over whether taping significantly reduces the frequency of recurrent ankle sprains. This study also noted that high ankle shoes should not and do not count as braces, and that bottom line, a structured rehabilitation program should be accompanied with a lace-up brace or taping, and that external support should continue to be used during high-risk activities, namely sports.
This leads us into talking about the first clinical guideline. This was involving essentially a systematic review without actually using that label, so they can only be used preliminarily, but it was studies published in Dutch, English, German, French, Spanish, Danish, or Swedish, and those were all eligible for inclusion. Now, narrative reviews, case reports, and analyses were excluded. It was a multidisciplinary guideline committee that was formed to update the guideline by looking at different articles. This involved general practitioners, emergency physicians, musculoskeletal radiologists, occupational physicians, orthopedic surgeons, rehabilitation physicians, physical therapists, athletic trainers, sports massage therapists, sports physicians, and trauma surgeons. Now, when treating patients with an acute lateral ankle sprain, they identified that modifiable risk factors like deficiencies in proprioception and range of motion should be identified and, if possible, included in a prevention and/or rehabilitation program to mitigate the risk for recurrent sprains. They identified this as level 3 evidence. Throughout their guideline, they classify the different levels of evidence that they found. Then they discuss the superiority of one external support over another, and really how it's debated rigorously in the literature. In regards to functional treatment, using an ankle brace has better outcomes than other types of functional treatment, such as sports tape, kinesio tape, or other forms of tape, without showing any side effects. Based on a small systematic review with a subject number of 276, it can be concluded that kinesio tape is unlikely to provide sufficient mechanical support in unstable ankles. Now, in regards to prevention, the jury is in that there is no drastic difference between bracing and taping, and this was level 1 evidence. Whether you go with a brace or a tape is really a personal choice, at least as they identified, and it's based on practical usability and costs. Both tape and brace have a role in the prevention of recurrent lateral ankle sprains, despite limited evidence on mechanisms that lead to these beneficial effects. The next clinical practice guideline was from the National Athletic Trainers Association, and it was their position statement on conservative management and prevention of ankle sprains in athletes. When it comes to this, the first block of recommendations that they made were under their return to play consideration section, and that's where they discuss prophylactic ankle bracing and taping. With these, they say that really both lace-up and semi-rigid ankle braces and the traditional taping are going to be effective in reducing recurrent ankle sprains. I just want to point out the fact that under their prevention section, their 3 different recommendations had nothing to do with ankle taping or bracing. Those are all parts of return to play for an athlete. Prevention involves balance and neuromuscular control. It involves addressing strength of the leg muscles, and also addressing limitations in dorsiflexion, and when the range of motion is limited, how that increases the risk of ankle sprains.
To conclude, taping and bracing both have a role in the prevention of recurrent lateral ankle sprains. Between the two, there is no clear winner. However, if you take into consideration the resources needed to apply tape, a brace is a more convenient and user-friendly option. Bracing and taping are not a substitute for proprioception and strengthening exercises. They are merely used as an addition. Additionally, we wanted to add that bracing has been shown to aid in the soft tissue healing process by reducing swelling, which is an added benefit.
Here are our references, and of course, if you do have any questions, please do not hesitate to make those comments and questions known in the information below. Thanks.